Hi, my name is Kelsey Walling, and I'm a dietetic intern here at Texas State University. I'm currently working to attain a master's degree in human nutrition. I'm here today to use the knowledge that I have acquired to educate my fellow nutrition professionals, specifically in the field of oncology, on nutrition-focused care for pediatric leukemia patients. To give you a brief outline, today I'm going to give a short introduction on leukemia. I'm going to describe the role of nutrition in leukemia treatment, and I'm also going to explain the role of the dietitian in the assessment and prevention of malnutrition in these patients, and also how to use nutrition to help manage the side effects of cancer treatment that patients may be experiencing. Lastly, I'm going to touch on outcomes and long-term care for pediatric leukemia patients. By the end of this presentation today, you will be able to understand the significant impact of nutrition in pediatric leukemia patients. You will have the strategies necessary to assess for malnutrition in these patients, and you'll be able to use your knowledge to provide meaningful nutrition recommendations that you may use to help lessen the side effects experienced by patients. Why study pediatric leukemia? Leukemia is the most common childhood cancer, as you can see in the graph shown to the right. It has an incidence of 4.7 out of every 100,000 cases. While this number may not seem significant, it is actually affecting a major portion of our population. The death rate is also 0.6 per 100,000 children each year. At this time, the current etiology is unknown, although there is some research that speculates the cause to be due to epigenetic or environmental factors. And this is important for us as dietitians to study because we are the experts who have the direct power to improve quality of life for patients. To brief you on some background information, leukemia is different from other cancers because it originates in the bone marrow when cells become abnormal and cancerous. These cancerous cells then build up in the bone marrow and they're able to crowd out healthy cells. They can then travel into the bloodstream and cause further damage. Treatments for leukemia aren't much different than for other cancer treatments, and they include chemotherapy, radiation or targeted therapy, immunotherapy, and stem cell transplant. A diagnosis can be acute or chronic leukemia. In children, almost 75% of all diagnoses are acute lymphocytic leukemia. A leukemia diagnosis based on the cell type can be either lymphocytic or myeloid leukemia. There is also a less well-known and less researched leukemia diagnosis, which is juvenile myelomonocytic leukemia, which affects a very small portion of the population. A dietitian can help in many ways with these patients. First of all, a dietary assessment of the patient is very necessary to really understand the patient's individual needs and then create a tailored treatment plan based on those needs. Dietitians also can provide counseling support to both the patients and caregivers. Dietitians can also recommend an appropriate nutrition therapy during the treatment and recovery process. Dietitians are also a indicator of the assessment and prevention of malnutrition and play a very important role to assess undernourishment of patients, as well as coordinating care with the whole disciplinary team working for the patient. The impact of nutrition is extremely important with pediatric leukemia patients. A patient's ability to tolerate the treatment that they are on will depend on their nutrient status if they're able to receive that kind of treatment for their body. Nutrition can also lead to a quicker recovery process and will decrease risk of infection through decreasing free radical production. Nutrition also boosts strength and energy of a child and will promote normal growth and development, leading to overall better quality of life. Malnutrition is an extremely important aspect to both assess and prevent in pediatric leukemia patients. A thorough assessment of malnutrition will include patient history, analyzing treatment symptoms, physical parameters, weight percentiles, and the overall support system for the patient. I've attached a helpful resource at the end of this PowerPoint outlining how to use the Pediatric Subjective Global Nutrition Assessment tool to assess malnutrition. As for prevention, it's important to encourage oral feeding by mouth as often as possible and knowing when to recommend eat-in or pee-in as necessary. It's also important to note the protein energy depletion if is occurring in the patient, as well as providing accurate and helpful nutrition counseling to both the caregivers and patient. Side effects are very common with any treatment that a patient is receiving for leukemia. To help combat nausea and vomiting, avoid bringing overly odorous foods to the patient's room. Consider a cool, light alternative instead. For diarrhea, to help offset the excretion of sodium, provide intake of salty foods such as crackers and pretzels. To combat dry mouth, sore throat, education on consuming soft, liquidous foods such as high-calorie smoothies, warm soups, and oatmeals. Lack of appetite is a very significant side effect that these patients experience. It's important to recommend high-calorie snacks and to know when to supplement with nutritional shakes if necessary. Helpful tips to increase protein and calories, as we have mentioned, high-calorie snacks are a great option. Including foods with fiber will help encourage proper satiety. Including 5 to 6 small meals a day rather than 2 to 3 large meals will also enhance calorie consumption, as well as having the patient eating their biggest meal when they feel hungriest throughout the day, even if this happens during breakfast time. It's also important to encourage fluids in between meals rather than with meals to prevent early satiety. It's also important to counsel patients to plan ahead, making large portions of meals for storage at a later date. And of course, supplementing with dietary intake of high-calorie smoothies and shakes if necessary. Fortunately, the outlook for the future of leukemia patients is looking better than ever, with, as you can see to the right, a very low death rate since 2017 when this data was taken. There is currently a downward death trend, and research shows the 5-year survival rate to be more than 80%. With this being said, it is also important during a patient's survivorship to counsel effectively on what a balanced diet looks like. One great way to do this, and a resource I have added to the end of this presentation, is Educate on My Plate, which helps to outline the major food groups and also has helpful recipes for caregivers. A short recap of what we have discussed today. We've talked about the incidence of leukemia in pediatric populations. We've talked about the ways a dietitian can use their nutrition expertise to improve the health outcomes of these patients. We've talked about strategies to assess and prevent the incidence of malnutrition in patients. And we discussed recommendations and tips that can be utilized to lessen the effects of treatment side effects in leukemia cancer patients. I have provided you some additional resources on this slide that I will hope you find useful in your practice. And I thank you very much for listening. If you have any questions or comments, please feel free to reply to this presentation, and I look forward to hearing your feedback. Thank you.